Hello, and welcome to our debate, in-home ABA therapy versus tele-ABA therapy. My name is Ryan, and I will be the moderator for this debate. When most people think of ABA therapy, they picture a therapist coming to the home, sending the child to a center, or meeting with a therapist at school. However, a new way of providing ABA services has grown popularity over the past few years. This is tele-ABA, which includes services performed remotely over the internet by way of video chat. Tele-ABA can involve therapy sessions or supervision sessions. While this method can be beneficial for some, tele-ABA raises some serious ethical concerns which we will address. I will now introduce the members of the group and the roles in this debate. Our stater is Audrey. Our provers are Katie and Fabiola, and the attackers will be Elizabeth and myself. Audrey, I will turn things over to you.
Thank you, Ryan. As you heard, I am your stater, and our ethical debate is on in-home ABA more ethically sound than tele-ABA. So our points in support of in-home ABA will include that there is a plethora of evidence-based research studies that have shown its effectiveness, and it provides clients with treatment and intervention efficacy because the behavior tutor or analyst is in the home to conduct the treatment. In-home ABA does not require families to be equipped with technologies that may not be affordable. And more effective supervision can be conducted, and the behavior analyst can be present during in-home ABA to ensure whoever is conducting treatment is providing the client with greater care. Also, treatment fidelity in in-home ABA is more sound because other observers can be there to ensure that treatment planning and behavior plans are being implemented properly. Our counterpoints in support of tele-ABA include there has been research and it has been qualified as effective and less costly than in-home ABA. Possibilities of not having therapists or analysts in the home can provide less distractions and better generalization to home and school life. You can provide services to areas that do not have the resources for in-home, and alternative training methods can provide families with high-quality videos to model in their treatment, and we're going to consider partial remote supervision. Now, I will direct it to our first prover, Fabiola, for argument 1.
Hi, I'm Fabiola, and I'm the prover. Behavior analysts are required to provide the most effective treatment to their client, meaning treatment that are based on the research literature and adapt to individual client. Code 2.09 discusses the client right to treatment and intervention and efficacy. In-home ABA therapy have been proven to be more ethically sound and effective for individuals with autism. Excuse me. A number of researchers have proven that when individuals with autism who receive intensive behavioral intervention, meaning between 30 to 40 hours per week before the age of 4, and at least for 2 years, dramatic improvement was noticed. A little less dramatic improvements have been demonstrated with less intensive intervention, meaning between 20 to 25 hours per week. These early studies provided demonstration of results achieved in both home programs and center-based programs. And a study conducted by WIST in 2006 examined the effectiveness of intensive behavior analytic home-based intervention for 40 hours a week for about 2 years. And participants included 19 boys and 1 girl with autism ranging between 20 to 65 months. Each received 6 hours of instruction per day, 7 days a week. And in the 3rd and 4th year, the children received school-based intervention in addition to the home-based intervention. 40 hours of therapy was required for at least the first 2 years and 20 hours for the last 2 years. During sessions, ABA teaching strategies such as shaping, discrete trial instruction, naturalistic teaching strategies, and reinforcement were used. Behavior plan included basic targets such as early expressive and receptive language programs, imitation and matching skills, and beginning social skills such as requesting. Um, those programs were modified based on the progress of each child, and childhood autism rating scales was used to assess all children. The result of the assessment showed that all children made progress with intensive home ABA therapy. And another reason why in-home therapy is also considered the most effective is because an important part of effective treatment for ASD includes the family. And in-home therapy give parents and families the opportunity to get involved in the therapy sessions, and consultant train them on how to make choices that are more effective and support happier and more successful living for those families.
Thank you, Fabiola. Now we'll hear from Ryan with the counterpoint.
Thanks, Audrey. While Fabiola raises some excellent points, there are studies out there that show that tele-ABA can be just as effective as in-home therapy and at a lower cost. One such study was done by Lindgren et al. In 2016 at the University of Iowa. This study looked at ABA services provided in the home, clinic-based telehealth services, and home-based telehealth services. The participants consisted of 94 children between the ages of 21 months to 84 months. These children had a diagnosis of autism or some other behavior disorder. The behaviors seen in these participants consisted of tantrums, aggression, and self-injury. These participants were split up into 3 groups. One group received in-home ABA services. One group received telehealth services at a regional clinic near their home. And the third group had home-based telehealth services. The overall results of the study showed that there was a 90% reduction in all 3 of the groups, which would indicate that teleservices can be just as effective as in-home. There was also parent participation there as well. The parents were coached by expert behavior therapists. Next, the reduction in cost. The things that factor into the cost of ABA services include how much is needed to pay staff, how much money goes towards the facility, and how much money the family pays for resources such as the internet. Lindgren et al. Estimate that the cost for in-person services is $291 per week versus $60 per week receiving telehealth, which is quite a large difference. I would also like to point out what Ethics Code 2.09c addresses. It says, in those instances where more than one scientifically supported treatment has been established, additional factors may be considered in selecting interventions, including but not limited to efficiency and cost effectiveness, risks and side effects of the interventions, client preference, and practitioner experience and training. We should take special note of where it says cost effectiveness. Based on the numbers, it is obvious that teleservices can be more cost effective, and it is a scientifically supported practice, so parents should have the right to be told the option to go to telehealth route if it seems like something that could fit their situation.
Thank you, Ryan. Now we'll hear from Katie for in-home ABA.
Thanks, Audrey. I'm Katie. I'm the second prover. So an ethical code that could be potentially violated using tele-ABA is code 4.07, which entails environmental conditions that interfere with implementation. As a behavior analysis, we have an obligation to eliminate environmental constraints. Conducting tele-ABA would be adding constraints to the environment. For example, if a power outage were to happen while delivering services to a client, what would happen? According to Wacker et al., there are limitations to technology available for tele-ABA, making in-home ABA a stronger ethical practice. This study discussed that little is known about parent and child characteristics that are connected to program engagement in telehealth-based parent-mediated intervention. Wacker reported that functional communication training could be adapted and used effectively by parents in their home when on-site coaching was available from a behavior analyst. Video-based ABA may be difficult for parents to overcome due to technological issues. This is something to think about when transitioning between different settings in the home. For example, if the student earned their reinforcement outside, would it be an issue with the internet connection? Ingersoll and Berger 2015 looked at families who participated in a pilot study of tele-ABA. There were two groups. First, parent self-directed, second, therapist-assisted. It looked at parent involvement and how that influenced their ability to teach their children. Parents in the therapist-assisted group rated the program slightly higher compared to those in the self-directed group. Ethical Code 5.04 discusses designing effective supervision and training. Delivering services via tele-ABA may be unethical when a behavior analysis is unable to supervise effectively. Visamera et al. 2013 conducted a study that looked at 9 families with children under the age of 36 months diagnosed with autism. The study used the Early Start Denver model, which promotes developmental growth for children with autism. The study was conducted using a video conferencing system and provided coaching and training to the parents. The study concluded that all 9 families expressed concern due to technical issues such as internet freezing. In the study, it was found that technology available is a limitation because not all families have the right technological supports. The study implicated that parents experience with technology can play a major factor in effective treatment in tele-ABA.
Thank you, Katie. Now we'll hear from Elizabeth for a counterpoint.
Thanks, Audrey. So Katie addresses a couple of potential issues with the use of live video-based ABA. And this is one area where well-organized ABA practice can provide the best support for their clients and families by weeding out those, or attempting to weed out those technological issues in advance. Behavior analysts have an ethical obligation to clients and families. Ethics Code 2.03 discusses the client's right to consultation in the form most appropriate for the client. And Code 2.09 discusses a client's right to effective treatment. Effective and appropriate treatment ultimately is defined as that which can be implemented with the highest level of fidelity. In a study prior to the Visamera et al. 2013 that Katie mentioned, Visamera, Young, and Rogers 2012 found that parents who participated in a telehealth-based training actually reported high overall satisfaction with the web-based process and thought it to be as effective and as beneficial as in-person. The difference between these two studies, the one that Katie mentioned and this 2012 Visamera, could give us some clues as to how, when, and for whom tele-ABA may be most appropriate. In Visamera et al. 2013, the type of concepts that were taught over video feed were much more complex than the Visamera, Young, and Rogers in 2012. So in the 2012 study, it had a narrower scope with a focus on increasing language and imitation skills in young children through the use of daily play and interaction with parents, circumstances that occurred naturally. The 2013 study that Katie talks about, however, trained parents on 10 ABA concepts. That's a lot. That included much more complex antecedent behavior consequence relationships and functional assessments for the purpose of developing behavior intervention plans. So those are content areas that we're learning about in graduate level coursework. And I would argue that they are not appropriate for tele-based consultation, and applying them to this medium would definitely affect treatment efficacy. and put it at risk. However, the earlier study by Vismera et al. 2012 makes a good case for a tele-ABA's ability to provide supplemental services where there would otherwise be none in place. In this way, tele-ABA could potentially increase the impact of services by meeting the families where they're at, in situations where they may be more comfortable, and also promoting generalization from the very beginning of applying tele-ABA in natural environment settings. So one way that behavior analysts can protect clients and stakeholders and ensure treatment fidelity during tele-ABA could be to establish and enforce eligibility criteria. For example, families must meet a set of technology and logistical standards in order to have tele-ABA in place of or in addition to in-home. Additionally, the severity and scope of problem behavior or the level of need for skill acquisition should be taken into consideration as part of the eligibility criteria. So if the client has severe problem behaviors or requires intensive adaptive skill acquisition, this is probably not for them. Rural populations are more likely affected by limited access to services. Wi-Fi and internet access is one for sure. This could require some creativity on the part of the caregiver. Is there a friend or family member's home where services could be provided? This is not an easily answered question, but we could also spend all day inventing the what ifs. What if the screen freezes, or what if the Wi-Fi cuts out? And this further begs the overarching question of who has access to ABA nationwide and who doesn't. More studies need to examine which populations are affected by limited access to in-home, to school-based, or to community-based ABA. And the studies that we've reviewed for this database do address limited access to services, whether through exceedingly long wait lists or actual physical barriers such as distance or lack of school funding, and as a national crisis. And discussion of access to services would kind of spin us off into a whole new debate at this point. But with this understanding, or with this information, I think we can agree that having a database or a comprehensive understanding of where we can and cannot access ABA would be hugely advantageous to the process. Back to you, Audrey.
Thank you, Elizabeth. Now we'll hear from Katie for in-home ABA.
Okay, thanks, Audrey. So Ethical Code 2.09 discusses the fact that clients have the right to effective treatment, meaning that it is adapted to the client. How can one provide tele-ABA if they cannot use various prompting methods? Grindle et al. 2009 found that there are limited prompting options when providing tele-ABA. Any physical or hand-over-hand prompting would be nearly impossible. This study also indicated that parent training would be limited as it would be difficult to teach prompting hierarchy. Ingersoll and Berger 2015 pointed out it is not clear what types of parents chose to enroll in telehealth parent-mediated intervention programs and whether they are more familiar with technology compared to parents who enroll in traditional parent-mediated intervention programs. A study by Grindle examined the effects of home-based early intensive behavior intervention on parents and siblings. Overall, families in the study reported a positive impact. In the study, it was said that nearly a quarter of parents reported that because the program was run in the home, they learned how to use effective behavior management techniques through observing therapists, using them, and learning hands-on. Another ethical concern includes informed consent. When providing informed consent, it is necessary to provide the involved parties with information regarding how services may be different if delivered via tele-ABA compared to in-home ABA. This includes describing risk and benefits specifically associated with tele-ABA and how it breaches confidentiality and how it would be mediated. The Health Insurance Portability and Accountability Act of 1996, HIPAA, requires safeguards to ensure the privacy of information transmitted electronically. One way to protect privacy during tele-ABA health practice procedures is to use a virtual private network called a VPN. A VPN provides several types of data protection, including confidentiality, integrity, and data origin authentication and access control. In fact, the most commonly used apps to talk through video are not HIPAA compliant whatsoever, such as Skype and FaceTime. Back to you, Audrey.
Thank you, Katie. Now we'll hear our last counterpoint from Elizabeth.
Thanks, Audrey. All right, so Katie addresses some additional technological limitations regarding parent training. And I would agree that families in locations where Wi-Fi or cable internet is not accessible may likely not be eligible for tele-ABA. But this doesn't necessarily make the practice of tele-ABA less effective or less ethical. And in fact, several studies suggest that the observed benefits to utilizing advanced technologies in the field may outweigh potential or hypothesized weaknesses. In a 2013 study, Wacker, Lee, Dalmu, Kopelman, Lindgren, Kuehl, Pelzel, Dyson, and Shields and Waldron examined the efficacy of parent training on the application of functional communication training when the parent training was delivered by behavioral analysts via telecommunications. In this study, parents gathered at a clinic where they were accompanied by behavioral consultants in person, but the parents engaged in live video-based training on functional communication training with behavior analysts who were over 200 miles away. The purpose of the study was to demonstrate how tele-ABA can be effective in training parents remotely. Wacker et al. In 2013 explained that utilizing tele-ABA specifically for functional communication training, a type of antecedent intervention, could potentially help ameliorate the demand for behavior intervention services, a demand that has families waiting months at a time. In a second study by Madzarova, Sturmy, and Jones in 2012, demonstrated the ways in which parent training can occur in a multi-component process. And with a well-organized use of technology, in this study, parents viewed on their own videos in which the verbal behavior concept of manding was modeled correctly. Afterward, they participated in role playing that was followed up with feedback on how well they implemented the concept. When the three treatment conditions, video modeling, feedback, and role playing, were isolated and then examined in different combinations, Madzarova et al. 2012 demonstrated that the combination of video modeling and feedback produced the highest rates of treatment fidelity. So this study could be applied in a live video setting in which parents simultaneously receive feedback and real-time video modeling. We could argue here that with a little creativity and technological savvy and attention to detail, a behavior analyst can provide ethically sound treatment and also supervision. So the efficacy and ethical integrity of tele-ABA has more to do with the ways in which it's delivered rather than whether it's singularly ineffective or singularly unethical. When we consider supervision of behavior therapists, RBTs, or other staff, behavior analysts have an ethical responsibility to provide effective supervision and training. This comes from Code 5.04, in which a behavior analyst must provide training that is, quote, behavior analytic in content. Using technology to increase client and staff access to a BCBA is not unethical in nature, but it must be done with the constraints that we're discussing here in mind. And it should further be acknowledged that not all families and not all RBTs and not all BCBAs will be well suited to tele-ABA. And this would be a decision made at the discretion of the supervising agency. Back to you, Audrey.
Thank you, Elizabeth. There have been many great points made for in-home ABA and tele-ABA. There are two other questions that I would like to ask the prover and the attacker. The prover, are there situations where tele-ABA is better suited than in-home ABA?
Yes, I say definitely. In rural areas where there are no in-home or center-based programs, tele-ABA would definitely be the most beneficial.
Thank you, Fabiola. And for the attacker, is a combination of the two something that could be possible?
Absolutely. We talk a lot about families who live in rural areas, and I actually work in a pretty rural area, very farm country, and there are behavior service providers kind of in the area, but the best that you're going to find are about an hour away. And I think that if you can make a trip out to the clinic once in a while and do like an in-home or in-clinic, then that's perfect. But in the days where you can't, or if it's too much, too costly, too much gas, what have you, then absolutely you can do a telehealth type of setup, and then on the other days go and do a person-to-person therapy.
Thank you, Ryan. So overall, we found out through this debate that we felt in-home ABA provides families with a little better support and treatment as a result of being present for help if needed. Also, treatment fidelity and supervision are very important for success in ABA, and this cannot necessarily be properly provided with tele-ABA. There definitely needs to be more research out there on tele-ABA, but we definitely found that there could be a combination of the two that would benefit people in rural areas. Thank you for listening.